It's time for Tech Bites Radio with your hostess, Laura from Business Solutions. It's a full hour of technology tips and news you can use.
Shall we begin?
I push this little button and poof.
And now for the show.
Good morning, Southwest Florida. This is Laura with Tech Bites Radio. I hope everyone's having a fantastic Saturday. I have a couple of guests in the studio with me. Jameson's here as always.
Good morning.
And we have Susan Kemper, Director of Psychiatric Medicine at NCH Healthcare Systems, and Barry Fitzgerald, Director of E-Team Florida, which is the outlet for Allscripts. And today's topic is electronic health records. I know the phones are going to light up today, but let me give you that phone number so you can call. It's 239-430-CHAT. That's 239-430-2428. Give us a call. It's a live call, and you can call in whenever you want. But we're talking about electronic health records and the EMR stimulus package that's going on. There's some new laws coming into effect, sort of mandates, but it comes up with some stimulus for the doctors and physicians and hospitals. And I just wanted to introduce, let me start with Susan.
Yes, good morning.
Good morning. How are you doing?
Excellent.
I appreciate you coming on the show today.
My pleasure.
Okay. And Barry?
Good morning.
Good morning. Okay. So we were talking, we had a heated, well, not really heated, but a very animated discussion out before the show. So I hope we still have some left for the audience. There are some new laws coming into effect. I guess they've been working on it for a couple of years. Is that correct, Barry?
That's correct.
And they go into effect 2014 as far as, is that correct?
Well, they actually start right now.
They start right now, but...
Right, but the final end point will be 2/13/2014, 2014, where they will be required to use EHR without getting a penalty.
Okay. And that's for any health provider and system, correct?
Any healthcare provider, that's correct. That provides services through Medicare and Medicaid.
Okay. So it will still apply to private practices if they...
Oh, absolutely.
Okay. I wanted to make sure of that. And go ahead, let's tell the audience what you do. You're with E-Team Florida for Allscripts, and that's a company that provides the electronic health record systems, correct?
That's correct.
And we work together a bit, but I want you to describe what you do. I mean,
okay.
I know your product and I know what we do with you, but you're the expert.
Some people say that.
In my experience with you, you're the expert.
Okay.
Wealth of knowledge.
I guess the big question is, why do we even want to go to EHR or electronic health record? Actually, it used to be called electronic medical records. It used to be called EMR. Mm-hmm. And now I say that because now the change is to EHR. Mm-hmm. And the emphasis now is on health rather than on medical. The emphasis on health, meaning much more positive, much more preventive care. Mm-hmm. So we're trying now to facilitate a process where we can kind of provide a healthcare service that enhances the healthcare delivery system and to make patients not use the system as much as they would use them before.
Right. And I know there's a lot of issues with privacy, and this is actually supposed to help with, I believe it would help with the privacy. You're getting away from paper entirely. But I know there's some people that are concerned about government involvement because it's going to be all electronic.
You're right, Laura. That's kind of a hot button.
It is a hot button, and I had to bring it up. So I want people to call in. So, but I want to help you calm people's fears about this, because I know there's a lot of people that immediately are like, Big Brother's watching. All my records are available for the government. I don't like this. And there's a lot of misinformation.
The anxieties pervade the whole system,
Mm-hmm.
Mainly because a lot of people resist change.
Right.
So there's a big issue with regard to change, even from the provider, meaning the doctor, mm-hmm. using the actual paper records and now having to be confronted with the issue of going to electronic. I recall maybe 10 or 15 years ago where the doctor's offices were using a 1500 form, which was manually. I mean, they would print them up, or they would actually write them up and then send them out to the insurance companies. Mm-hmm. And then the government said, well, this is not an efficient process, and there were a lot of delays in that process. So they had to go to electronic 1500 forms. Well, we didn't use the term electronic then, but it was electronic. And there was an incentive at that point to kind of move it to a automatic 1500 form submission which many of the providers do that every day and don't even give it a second thought right now. The point I'm making is that, yes, we were concerned. We had a lot of anxiety, frustrations with regard to going to an automatic 1500 form, which is the billing form that the doctors use to bill the insurance companies. They had a lot of trepidation at that point. Now they're having trepidation to going to the electronic health record. That's one level of anxiety. The second one, which I mentioned, was the hot button issue, and that is the patient. Whoa.
Oh, yeah.
Now, who's got my records? Now, I knew my record was sitting on the wall in my doctor's office. Now I don't know where my record is. So that's that's anxiety provoking in itself. And how do I know where this thing is going to be? Well, there are several solutions to that right now, and the government is making a lot of effort at trying to secure the privacy of those particular records. And they're spending, in my experience right now, they've been spending the last couple of years reviewing this process to ensure that there are no violations to the integrity of that medical record. They have moved the sanctions from the federal level to the state level so that the state attorney general within the state of Florida here now has the authority to punish or to go after any violation of privacy records that are in electronic format.
Yeah, we were talking about that, and Susan, you said that there's internal reprimands, like even if you look at your own health record.
Correct, yes. At NCH, they take the HIPAA privacy and the 42 CFR, which protects psychiatric and substance abuse records, very seriously. We monitor that periodically. There are audits done to make sure that people are not looking at other patients' records. It's all about what we call the need to know.
Right.
And I had a nurse call me the other day after hours and said that she was being asked to review a record to potentially accept a patient. She did not have a doctor's order to do that. And so she called me and said, do I have permission? I called the privacy officer, and because of the need to know, she was given permission. So even at that level, we take it very, very seriously.
So, I mean, the electronic health records, it's really not going to be as big of an issue for the patient as far as, I know they're worried about people looking at their stuff, but there are things in place both at a company level,
yes,
an organizational level, as well as a state level. And if, say, somebody was to leak someone's records, we have a lot of high-profile people here. So someone was to leak someone's record, what would happen to them?
They would be terminated, and there would probably be legal sanctions as well. I think that one of the benefits of the electronic medical record is it gives you the ability to be able to access your information if you need it. So if you're, as long as you have permission, if you're in Arizona, for example, and you had a mammogram done here, they can electronically send that. Somebody can look at it. So it's very positive.
Right. That's one of the things Barry and I were talking about is if you have your prescriptions all there and other doctors can access your health records, your prescriptions, there's less likely of a situation of being prescribed a counteractive prescription by a different doctor, which in my opinion, I've seen some people that will go play one doctor off the other. They'll go to one doctor and get some prescription and then go to a different doctor thinking that they're not going to know and get an extra prescription and kind of use it to abuse the prescription.
Called, doctor shopping. Actually, when we were in New Hampshire, the state was beginning to have a collaborative effort to ensure that any patient that was on Medicaid, that those records were being managed so that we didn't have people that had addiction issues going from hospital to hospital and then, getting the prescriptions and then selling the drugs on the street.
Right, exactly. And what Allscripts does is you can help prevent that because any electronic health record system can help prevent that in the future. But
we're mandated to prevent that.
Exactly.
Actually mandated. We have to be certified, and we are currently certified under the current certifying authority. That may change within the next year or so, and they're suggesting maybe multiple certifying authorities. But right now it's CCHIT. And they are mandating restrictions on how we handle that. But it's a balancing act, and I can understand from a patient point of view, I'm really apprehensive. I'm talking as if I were a patient. And where are my records and where are they going? Well, there are several solutions that are available. And one is Microsoft has a vault where your patient record can be reposited. You can maintain your patient record in the Microsoft Vault. And that is, you are the only one that has access to that information, or anyone that you would authorize to access. Well, why would you want to do that? One of the reasons you would want to do that is if I'm in Naples, Florida, and I travel to New York, I don't want to bring all my medical records there, and I'm going to be up there for 3 or 4 months. I want to have the doctor that I may have to see in New York have access to my medical record without having to fax them or send them overnight from the doctor that I'm seeing down here in Naples. Well, you just go to New York. You tell your doctor, you give authority to the vault, saying my doctor in New York now has access to my medical records, which are in the vault. And that's access through the internet. That's one way. Another way is, which is being tried in New York and Long Island, is that there are chips, USB chips that are available that hold your current medical record that you carry with you. So that's one other possibility.
That's great for in an emergency if you're traveling. In an emergency, you have that with you. We actually have to go to break, but I want to go back to this when we come back from the break. Call into the station, 239-430-CHAT. That's 239-430-2428. We'll be right back after these messages.
World of Golf has been a Naples landmark since 1986 and is one of the top 100 golf shops in the USA. World of Golf offers an extensive inventory of new and used equipment for men, women, and juniors in all price ranges. World of Golf has a professional, customer-friendly staff willing and able to help with any of your golfing needs. Conveniently located in the Park Shore area at 4500 Tamiami Trail North in Naples, World of Golf is here for all of your golfing equipment, fashion, and accessory needs. Call World of Golf at 263-4999. That's 263-4999, or visit worldofgolf.com.
The Bite Shop Computers, the name you've known and come to depend on for years, now has a new store in the exciting new Mercado Shopping Plaza in North Naples. Now not only does the Bite Shop service and sell computers, but their new location is called Bite Shop Style, where they specialize in home automation, home theater systems, and even have a 14-seat training classroom. They can train you individually as well. On the home theater side, they can turn your living room into the latest state-of-the-art theater that can easily be remotely controlled by the click of a button. They simplify home entertainment and even provide the training on how to run all this neat new technology. With computers, personal communication, and home entertainment more integrated than ever, who better than the Bite Shop to bring it all together in one location and make it all come together for you? So stop in today at Naples' newest upscale shopping location, Mercado. The Bite Shop Style, located right across from Bravo Restaurant at Mercado, located off Vanderbilt Beach Road and North Tamiami Trail.
Solve it all with a Bite Shop.
T3 Communications is your local phone company, specializing in local and long-distance phone services, internet services, and PBX and voice-over IP phone systems. Headquartered in Fort Myers and serving Southwest Florida, T3 Communications has 24/7 live technical support with locally based technicians. T3 Communications also offers data center co-location services to protect your IT infrastructure. T3 Communications is offering special pricing for Tech Bites radio listeners. Call 239-333-2983. That's 239-333-BYTE for your special pricing, and ask Ben about your Tech Bites radio discount. T3 Communications, your local phone company.
AZN Asian Cuisine, Naples' newest hotspot for lunch and dinner, featuring Pan-Asian cuisine, alfresco dining, and an impressive sushi menu. Come join us for our lunch bento boxes all week long or our nightly dinner specials. The place to see and to be seen at the corner of Vanderbilt Beach Road and US 41 in the Mercado Shops in Naples. For reservations, please give us a call at 239-593-8818 or visit us on the web at aznrestaurant.com.
Hi, this is Laura from Tech Bites Radio. You know where to go for your groceries, but what do you do when you need goods, repairs, or services and you don't know where to go? Don't play phone book roulette. Go to citybizdirectory.com to find quality businesses with integrity. You can even get free gift certificates and see the difference yourself. If you own a quality business and think you qualify, you can contact me and I will be happy to introduce you. Click the link on our website or just go to citybizdirectory.com for all the info.